Hello and welcome to another edition of Health Matters. I am your host, Dr. Michael Chalemi. And on this episode, we're going to unravel complex medical topics in a way that is easy to understand and deeply insightful. In this episode, we're going to dive headfirst into structural, spinal abnormalities, specifically scoliosis, kyphosis, and lordosis. Say that fast 10 times. Let's see what happens. Okay, so these are more than just medical terms. They represent conditions that affect millions of people worldwide, influencing their health, the quality of their life, and how individuals go about their everyday activities. So grab your notebook, whether you're a curious learner or someone who's dealing with this condition yourselves, because we are going to go deep into the anatomy, the causes, the treatment, impact on life of this challenging spinal condition. So let's start with the basics, spinal anatomy. Right before we can really understand what it is, we got to fully understand the spinal structures, the structural abnormalities of the spine. So with that said, the spine or the vertebral column is essentially structured of 33 grouped into 5 different sections, right? Cervical, which is the neck, 7 vertebrae. Thoracic, which is the upper and middle back, there's 12 vertebrae. Lumbar, or the lower back, there's 5 vertebrae. Sacral, which is the pelvis region, there's 5 fused vertebrae. And the coccygeal, which is the tailbone, is 4 fused vertebrae. So the spine provides and support protection to the spinal cord and enables flexibility and movement. A healthy spine has natural curves. So your spine always does have a curve. So some people don't understand this, that your spine does have a curve and it needs to have a curve, right? So the normal kyphotic curve is in your thoracic and sacral regions, which means kyphotic, meaning it curves outward. Then you have your cervical and lumbar, which are normal lordotic curves, which means it curves inward. When these curves become exaggerated or abnormal, we have conditions called scoliosis, kyphosis, and lordosis, right? So your normal lordotic curve is an inward curve, which is in your neck or lower back. Your kyphotic curve, which is your outward curve, is in your mid back, which is your thoracic, and your sacral, which is your lower part of the lowest part of your spine. Okay, so let's get into scoliosis. What is scoliosis? Scoliosis is characterized by an abnormal lateral curve of the spine, creating a S or C shaped when viewed from the back, instead of the spine running straight up and down. Scoliosis usually causes the spine to twist or curve to one side. So you might have especially if it's in your thoracic spine, you might have like a little bit of a hunch on one side compared to the other. Or when you lay down, one side might feel really uncomfortable when you lay on one side because your body's twisted a little bit. And you might not even know it. It might not be enough for you to even see or anybody to see because the curve is pronounced enough. But when you lay down, you might know when you turn or twist a certain way, you'll feel it a little bit more or it'll get irritated. Or if you're a woman and you're putting your bras on, you'll have your straps on one side higher than the other, and it'll cause some imbalances in your shoulder height. We'll get to some of that. So scoliosis, is it common? It affects about 2 to 3% of the population, according to the National Scoliosis Foundation. It is mostly diagnosed in adolescence during growth spurts, but can develop at any age. How does scoliosis typically affect your life? Scoliosis severity can range from very mild to very, very severe. Mild cases can result in minimal symptoms, but the severe curves can cause uneven shoulders, uneven hips, uneven ribs, chronic back pain, reduced lung function in severe cases, changes in your chest cavity, and obviously some emotional traumas due to self-esteem issues, due to physical differences. Scoliosis can be classified by its causes, right? So let's break it down into its causes. First cause is going to be idiopathic. This definition is, well, this is the most common form of scoliosis and is characterized by a curvature of the spine with no identifiable causes. So basically, they have no idea what happens. So being a practitioner for the past, 28 years. 28, yeah, that's true. I know, I can't believe it either, 28, but that's true. 28 years, I've seen a lot of scoliosis in my time, and the best way what I tell patients is when they have no idea what happened, right, or why it happens. The common thought is with an idiopathic scoliosis is that you have growth spurts as you're growing from when you become an adolescent, and sometimes your body cannot adapt to how fast you're growing, and it buckles underneath the pressure, and that's why the curve happens, right? It's trying to adapt, and it just can't adapt fast enough. You might have a growth spurt that you grow 4 or 5 inches in a summer. Like, oh my God, you got so tall. And sometimes when you get that tall that fast, the spine cannot adapt. Your body can't grow fast enough, and you buckle under the pressure of basically like you could say like a leaf, and you put a little bit of water on it and it buckles down. That's kind of what happens to the spine. Probably not the best analogy, but you get what I'm saying. Your body twists to take the pressure off because it hasn't been matured enough to catch up to you. That is the common theory of why the idiopathic condition happens, right? Because they really don't know. There's no definite answer. Oh, that's 100% it. It's a theory, and it's a common theory of it. Idiopathic could also kind of happen when you're an infant or a juvenile, but it is definitely less common. There could be some genetic or hereditary components, but no direct cause is identified. Idiopathic scoliosis makes up 80%, 80% of all scoliosis cases. Symptoms are largely asymptomatic, meaning they have no symptoms, but they can have uneven shoulders, uneven hips, or even back pain. Sometimes the cases could be mild enough where it just falls into enough of a curve change where it becomes scoliosis, but you can't really see it. And typically, if you're eyeballing it, you're not going to see it unless you have an X-ray. That's the reality of it. Another type of condition, a type of scoliosis, is congenital scoliosis. So congenital scoliosis is caused by a structural abnormality in the spine that's usually presented at birth due to improper vertebral formations or segmental dysfunction during fetal development. Results from birth defects affecting the spine, maybe the vertebrae partially formed or failed to fully separate properly. It's typically diagnosed early on in life, infancy and early childhood. It could be also associated with other congenital abnormalities involving your heart, your kidneys, or your nervous system. Typically can worsen more rapidly during growth spurts due to structural irregularities. Typically, this condition needs to be managed often with close monitoring for early intervention, which is usually bracing or surgery, depending on how much defect is there. Another type of scoliosis is neuromuscular scoliosis. So this is scoliosis that develops as a secondary condition to a disorder that affects muscles, nerves, or connective tissue. Commonly associated with conditions of cerebral palsy, muscular dystrophy, spina bifida, or other spinal cord injuries. Occurs usually because of weak or unbalanced muscles which lead to abnormal spinal alignment. The progression of the curve can be more severe compared to other conditions. Treatment often needs to address the underlying neuromuscular condition alongside of the scoliosis. The symptoms are usually severe, and it is difficult for most people to sit upright, and they can have even potential breathing issues. So it's very, very severe in these cases. These are individuals that are having a tough go of it and really need to be managed well. Another type of scoliosis is degenerative scoliosis, also known as adult onset scoliosis. So that typically refers to a condition where the spine curve becomes abnormal due to age-related degeneration of the vertebrae and the surrounding structures. Unlike idiopathic scoliosis, which typically occurs during adolescence and has no clear cause, degenerative scoliosis develops later in life as a result of the natural aging process, combined with wear and tear on the spine and the different changes within the disc. Well, you know what? Let's get into it. So how does it happen? Let me get into how it happens. So the primary factors contributing to degenerative scoliosis include intervertebral disc degeneration. So over time, the discs between the spinal vertebrae wear down. They lose hydration. And when they lose hydration, the spacing between them decreases. So when that decreases, that can actually collapse the area, and that can create an instability. And then that can cause a scoliosis. You could have facet joint arthritis. Arthritis is the facet joints are the small joints between the two different spines of spinal vertebrae. And you can have wear and tear, and that can cause one side to collapse or shift, and that can cause a scoliosis. You could have osteoporosis. Osteoporosis is weakening of the bones that is associated with aging and can exacerbate spinal misalignments. You could have muscle weakness as you age. So as you age, we tend to get weaker in muscle mass and strength, causing your muscles to be imbalanced, reducing the spine's ability to maintain normal alignment. You could have spinal stenosis. So that's narrowing of the spinal canal due to degenerative changes that can worsen the condition and lead to nerve root compression. You could have had past spinal trauma, whether it was an osteoporotic fracture, previous injury, or surgery. Anything that can destabilize the spine can contribute to scoliosis. Loss of height. Disc degeneration combined with vertebral compression fractures may result in increasing spinal curves or deformities. So that is a big topic, and it is a big area of concern with patients that have scoliosis, right? Is you could be in your 30s and 40s and have maybe a 15 or 20 degree scoliosis, and it's considered stabilized. But as you get older, into your 50s, 60s, and 70s, your spine changes. Those disc heights decrease. Your bones become arthritic. When that happens, your scoliosis can actually become worse, and it happens to a lot of patients. It actually does get worse, and patients are affected by it. And it is something that should be addressed and taken care of. The aging process uniquely affects adults with scoliosis, leading to several changes. So progression of the spinal curve, unlike adolescent idiopathic scoliosis. So I'm going to preface this by saying you could have the idiopathic, you could have the congenital, or you could have the neuromuscular scoliosis. And all of them can become a part of degenerative scoliosis, right? So it could start as obviously adolescent, and as that adolescent gets older, you can have problems that are increased because of your degeneration. So the curve in degenerative scoliosis tends to be small but moderate and can slowly progress due to instability. And usually you're going to have some pain with this. You could have pain localized due to the area, and you could have some muscle compressions, some nerve compressions. You can have loss of motion and function. So you could be really stiff and painful, and you could even affect some of your nerves. So it is important to really take care of it. So the key factor to take away is you could have idiopathic adolescent scoliosis, and it really not really affect you from the time you're 15 to the time you're 45, 50, 55, 60. And then you could develop degenerative scoliosis, and that curve can actually get worse. So that's the thing you really got to be careful of. And that's why spinal health is important, and to keeping your joints moving and keeping them functioning is really critical, because you want to make sure your spine moves and is functioning. Movement is life. The lack of movement equals the lack of life in that area, and it is critical for you to keep that functioning. So what are some preventative measures? Although degenerative scoliosis is often associated with a natural aging process, several things you can do to slow it down the progression. You could exercise regularly, right? Swimming, walking, yoga, maintain your spinal strength and flexibility. Even weightlifting can increase your spinal weight strength. Bone health, ensure adequate calcium, vitamin D intake. Getting regular posture checks and early intervention is critical for trying to really manage this condition. Degenerative scoliosis is a very common condition, and it can be managed, but the longer and worse it gets, the harder it can be to treat. So the key point of that is early diagnosis and treatment is critical for maintaining a good quality of life. Don't just sit by and wait and let things happen. Let it get treated. Okay, so in general, treatment for scoliosis really depends on, and I'm not talking degenerative, I'm talking in general. Treatment for scoliosis depends on the curve's severity. Treatment typically aims to alleviate symptoms and prevent further progression. That includes both non-surgical and surgical interventions. So let's talk about some conservative therapy. So obviously chiropractic, we typically target spinal adjustments to reduce spinal misalignments. We're going to improve mobility and manage pain. And one of the things that I'm going to tell you that most people don't tell you or won't tell you is when patients ask me, hey doc, can we fix this curve? The hard reality is most scolioses will not correct. Can you have a small degree of scoliosis change? Yes. As muscle imbalances get treated and you consistently get yourself treated and you treat the area around it, you can have a small degree of change, but usually it really doesn't change that much. And that's what I tell patients all the time. I don't want somebody telling you a fabricated story that they're going to change your curve and get your spine straight again with treatment or therapy. It's just really not going to happen. It's really a misleading statement to say to somebody, and it actually really upsets me that people do that, because I've had patients say, oh, this person said they can correct it, and no, you can manage it, right? So we can manage the condition and hopefully try not to make it get worse by keeping the mobility and keeping the flexibility, keeping your spine adjusted. That is what we want to do. We want to manage it. So we want to try to make sure it doesn't get worse. That is what we want to do. That's what I want to do anyway. That's what I look to tell my patients. You know, I really try to be very, very transparent. I would never want to give somebody false hope, because my goal is always to win, right? And if I give you a false presentation of what it is or what it can be, then I'm not going to win for you, and I'm not going to win for me. I win when you win as the patient, right? So that's how. Well, in my office, all the treating physicians win when our patient, if the patients don't get better, then we don't win, right? And we aim to win on a daily basis. We're actually really pretty good at it. So I've been very blessed for 28 years to really have done that for many, many years and really help a lot of patients do that. I always find that, the more transparent you are with patients with their goals and expectations, the better they do, at least in my office. Okay, what other conservative treatments? Physical therapy, obviously, right? So we want to utilize physical therapy for exercises to improve posture, strengthening muscles, support the spine, specific stretching and core stabilization exercises, all to prevent progression. Bracing, especially in growing children and adolescents, bracing is going to be important. There are braces that help halt curve progression. And this is a non-invasive option and for those mild and moderate cases. And it is something that you really got to, depends how bad the curve is, you really got to get a brace on the young early. The earlier, the better. They're not going to like it, right? Some of the braces are large and you got to wear them for many hours, especially if you have a 25 or a 30 or 35 degree curve. They're not going to like it, but at the end of the day, you're trying to help them and save them from getting it worse. And you're trying to make sure that you don't have an organ problem, right? So when you have those severe scoliosis, you could have organ problems, and it is something that you really got to be careful of, and you got to be conscious and cognitive of it so it doesn't get worse. There are medications that you could take for over the counter, and that's just really for pain relief. Some docs can do steroid injections to help with localized pain. And as always, lifestyle modifications, right? Weight management, and healthy diet to improve your bone health is always critical. So some of the surgical options that they do, you could do spinal fusion, which is basically permanently fusing the spine to stabilize the curve. You could do decompression surgery, removing tissue on areas like stenosis to decrease the pressure on it. Instrumental stabilization, using screws, rods, cages to realign the spine. So in severe scoliosis, you will use what we call hardware. In your orthopedic surgeon would be, or your neurosurgeon would be the one to do that, to stabilize your spine in severe cases. I've seen some pretty incredible changes in patients' spines from some incredible spinal surgeons that really has changed the impact of patients' lives because of, they might have had a 40 or 50 degree scoliosis, and that is a large scoliosis, and that affects that patient's life every single day. And if they could do a surgery like that, it's a big surgery. Don't get me wrong, it's a very big surgery, but you're going to save those, the organs and different other areas from really having a problem throughout that life. I mean, obviously there's sacrifices, right? You're going to have hardware in you forever. That doesn't come out, right? When they put rods and screws to realign your spine, it is obviously a condition that needs it, and it is significant, but it does work for patients. It helps prevent the nerve compressions and all the other problems that are associated with it. Okay, next condition we're going to talk about is kyphosis. So kyphosis is an excessive outward curve of the thoracic spine leading to hunchback, right? I'm sure everybody's seen those people who are hunched and bent all the way over. That is called kyphosis. While some degrees of kyphotic curve is normal, an exaggerated curve is a problem. How common is it? Kyphosis affects millions globally and can occur at any age, but is mostly seen in the older senior community due to spinal degeneration. Kyphosis can affect your life because you could have visible rounding of the upper back and shoulders. You could have back pain and stiffness, breathing problems in severe cases, decreased self-esteem due to physical appearances. How does somebody get this? Causes: poor posture. So in my practice now, I see a lot of patients that have kyphosis because they are hunched over all day on a computer and a monitor, and their ergonomics are not correct, or they're tech necking down with their phone in their lap and they're bent completely over. They do this for hours and hours and hours. And the tech neck is a real condition. You know what? That will be my next podcast. Good idea. I got you. No, when your head is all the way down, your shoulders become round, and your posture will change over time. So you do anything long enough, your body will adapt to it and it will change. And the postural kyphosis is a problem. You could have something called Schumann's kyphosis, which is a structural problem in adolescence during growth spurts. You could have age-related kyphosis, which is the degeneration, and you could have the other problems such as spinal tumors, traumas, or osteoporosis. Treatments for kyphosis. Similar to physical therapy, chiropractic care, we're going to work on the spinal bones to take the pressure to reduce stress and balance the spinal alignments. We're going to utilize physical therapy for posture correction, muscle strengthening, and improved mobilities. We're going to also look at bracing. Similar to scoliosis, kyphosis braces can be helpful for young adults. Lifestyle changes, as always, weight management, and the biggest change is implementing ergonomic furniture or chairs, and practicing good posture can prevent it from worsening. So that old saying of your mother saying, sit up straight, sit up straight. Guess what? I hate to tell you, your mother was right. You should have sat up straight because it can be prevented. It doesn't have to be for most cases. Sit up straight, proper posture is critical. And most people don't like me saying that when I have teens in there or young adults, and I say you should listen to your mother. They don't like me here to say that. In the non-conservative treatments, severe cases may require surgical intervention such as spinal fusion to prevent that curve from getting worse. Okay, next curve, lordosis. So lordosis is defined as an excessive inward curve of the spine, and that typically can create an exaggerated sway back when viewed from the side. Usually this can happen in the lower back or neck. Lordosis can seem as if the pelvis is tilted forward. How common is it? Lordosis is common, but often underdiagnosed. It occurs both with children and adults, and it typically rises with individuals with obesity and sedentary lifestyles. And sedentary lifestyles is a problem right now, especially with computers and kids on all these gaming devices for all day and night. So they go from computers to gaming devices. They're sitting all day, every day. The old idea of going outside and playing almost does not exist, right? Unless you're on a sport. You know, the 25 years ago, we didn't have all these new advancements, which are theoretically better for you. You know, kids actually played outside and played on a swing or played tag and ran or do all kinds of things outside, right? Actually ride a bike. Now everybody is sedentary and they wonder why their society as a whole is becoming obese. Got to get out and move. Movement is life. I digress. Sorry. How does it affect your life having lordosis? So muscle imbalances often cause tight hip flexors and weak abdominal muscles, lower back pain that can worsen with prolonged standing or walking. It's primarily in the lumbar spine. Lordosis is primarily seen in the lumbar spine where it's a problem. You could have potential walking problems or mobility issues due to severe cases. So what are the causes? Again, postural habits, poor posture, obesity, and sedentary behavior. You could have structural abnormalities like osteoporosis or spondylolisthesis, and you could have it from developmental conditions such as muscular disorders like cerebral palsy. Typical treatments, as you would expect, chiropractic care, we're going to treat those spinal segments to reduce stress and improve balance and posture through the spine. We're going to utilize the physical therapy for core strength stabilization, pelvic alignment, and stretching for those tight muscles. Non-conservative treatments, the surgery, which is the last resort, often reserved for those with debilitating pain from this condition. So when we talk about some of these changes, I want to talk about how, whether it's scoliosis, the lordosis, or the kyphosis, we'll look at really more scoliosis. How is scoliosis, I know I'm jumping back into it, but scoliosis, how it affects your everyday life. So it can really vary for a lot of people. And let's get into some of the physical defects of it. Well, some of the physical effects of it, right? You could have postural changes. So you could have uneven shoulders, uneven hips, or your waistline. You put a pair of pants on and it's tilting. Like, what is going on? One side's way higher than the other. You don't understand why. It could be because of that. You could have a rib cage asymmetry, which can lead to a noticeable hump in severe cases, which can be difficult for you to maintain an upright posture. You could have back pain, mild discomfort, and it could be more severe in severe cases. If it's chronic, you could have chronic sprain strains of the muscles causing dysfunction throughout, which then can lead to your limited mobility, right? The next is limited mobility. Severe curves can restrict motional flexibility due to pain. Physical activities may become harder to perform, especially heavy lifting, twisting, or bending. In severe cases, you could actually have breathing problems. A significant spinal curve can compress the lungs and limit your breathing capacity, especially in thoracic scoliosis. In cases of scoliosis, you could have some emotional and psychological effects. Why? Body image concerns, right? Visible spinal defects can impact someone's self-esteem, which can lead to feelings of insecurities, especially in teenagers. Kids are mean. Let's be real. Kids are mean these days. Whether they say it to your face or now all the online bullying, kids can be very mean, and they don't realize the little things they say can affect you. And those things, usually stick with people throughout life. So be kind. Your clothing may fit unevenly due to asymmetry, which can further affect your confidence, right? So you feel you're a little lopsided, like, what is happening? I don't understand. And that could be because of your scoliosis. Other emotional concerns could be social isolation. Some individuals, particularly children and adolescents, may feel self-conscious and avoid social situations. They don't even want to go out and play because of the physical differences, and that causes some stress and anxiety, right? Especially the worsening of scoliosis, the pain, needing with the treatments, the bracing, it can cause some emotional defects. So what are some of the daily life impacts from scoliosis? You could have difficulty sleeping, right? The curvature related pain or discomfort may make it hard to find a comfortable position. Maybe you can't lay on your left side or can't lay on your right side, or it's hard for you to sleep on your back. Don't ever sleep on your belly. That's the worst. You put your curve in actually the complete wrong positions. Definitely. Tip of the day, do not sleep on your belly. Problems happen. You could have reduced physical capabilities, right? Lifting, twisting, or prolonged sitting or standing may become challenging depending on the severity of the curve. Impact on your school or work. Pain can make it hard to stay focused during class or work hours. You might have to, change your position and you might have to stand or sit. Long periods of sitting or standing can be very, very taxing and painful. your participation in sports or hobbies. So the mild scoliosis generally allows for normal activities, but severe cases may limit your physical abilities to do some of those events. Let's take a look at some positive outlook of it. Many people with mild scoliosis live basically 100% normal life without major interruptions. With proactive care and healthy, active lifestyle, they typically have a normal life. Even those with moderate scoliosis can have minimize its effect with early treatment and continued treatment and therapy and muscle balances. Advanced cases usually require more intervention, but still allow for adaptation to everyday activities. Let's put it all together. Scoliosis, kyphosis, and lordosis are not just conditions. They are part of the human experience of living with an abnormal spine. Whether it's mild or severe, these imperfections remind us of the importance of spinal health and proactive care. Treatments ranging from chiropractic care to physical therapy or surgical interventions can be effective in improving function and the quality of life. For those living with these conditions, remember, you are not alone. There's a wide variety of support networks, technologies, and medical advancements today that can help you lead to a healthy, fulfilling life. Well, that's going to be pretty much all for today's episode. If you found this deep dive into spinal structure abnormalities informative, please share it with a friend. Please leave a review if you like it. If you didn't like it, don't leave a review. No, just kidding. Subscribe to our channel. If you have a friend, though, all kidding aside, if you have a friend or family member that has a scoliosis or a lordotic condition, or maybe a grandmother, a mother, sister, uncle, brother, or a child, please, this episode is short. Please take a look at it. Maybe something I said in here will spike them to get the proper treatment or therapy they need so it doesn't get worse, or they didn't understand what they had. They didn't even know they have it. I have patients on a daily basis that I will tell them they have a double scoliosis, basically meaning you have an S curve. You have one in your thoracic and one in your lumbar. And they're like, oh my God, I never knew it, but that makes total sense of why I was having this problem or that problem, or why my pants were completely uneven. I never felt right. And my muscles always felt imbalanced. I always had tightness on this side. They never understood why. And, you know, it is critical for people that have that to have a better understanding. But sometimes you just don't know, right? If you didn't have an x-ray, or the school nurse didn't actually check you back then, or you didn't develop it then, you know, most times it doesn't happen until you hit puberty. So a lot of people just don't pay attention. Life is busy, and unless you complain about it, people do not pay attention. So if you know somebody that has a problem, or might have a problem, or you saw a hunch, or you saw something, or your mother, your grandmother has a hunchback, that is, get checked yourself. You want to make sure it doesn't, you don't get it, and you want to do the proper spinal health to take care of that. And remember, your spine deserves love and care. So sit up straight, stretch, daily exercises, invest in your health. Because as I always say, well, before I always say, I'm going to say, the information you received here is not medical advice. This is my opinion alone. Please go see a provider, a doctor, to help you with your condition. But what I always do say is your health is important. Your health is the main thing you have in life, right? Without health, it doesn't matter. It doesn't matter if you have a dollar or $1 million. If you have bad health, life is just not that good. And it is important for you to take advantage of that. So as always, I say, stay healthy, stay curious. And as it involves you, your health matters. I'm Dr. Chilemi. Till next time, be well.